we've been making bruxism splints for patients who brux. And after a while, after bruxism splint, after bruxism splint, after bruxism splint, I began to question, as well as others, what was its purpose? Well, it's a bruxism splint, it's for bruxism. But what was its mechanism? What was it trying to do? For many, it was going to change the jaw position, or it was going to eliminate interferences, which we've learned don't cause bruxism. Interesting study was done in Italy where they gave women interferences to occlusion, and they evaluated their symptoms and found no increase in symptoms. Now, this was an unusual group of women. There were 20 women who had no signs, no symptoms, no wear facets, no complaints. The point was that interferences don't cause bruxism. We don't know what causes it, but we know it happens. And what was the purpose of the appliance? What the purpose of the appliance was to interfere. But when we looked at the forces that were the result of the bruxism, what we learned was that the appliances didn't decrease the forces when a patient brux. In fact, in many cases, it increased the forces. So that those forces, depending on the force vectors that would go to the joints, to the muscles, to the teeth, to the autonomic nervous system, to the ligaments, all increased or stayed the same with a full arch appliance. And then what we discovered is that if we eliminated the posterior teeth and we didn't let the back teeth touch, the forces decreased. So for many years, back in 1960, interesting studies were done to show that anterior deprogrammers could be effective in reducing patients' symptoms, not ever stopping them from brux, but altering the forces when they did brux. So now we come along and we learned about enhanced deprogrammers that are even more effective, and we don't even refer to them as deprogrammers anymore. Appliances that alter bruxism and NTI in effective ways. We get tremendous results. It's beyond me why everyone doesn't use them as a bruxism appliance.